Okay, hello you guys. Sorry I can't see you there for the meeting. Um, so what I'm going to talk today about is finding the line between family life education and family therapy and why it's important. So why is there a hard time differentiating between the two? Family therapy deals with very intense personal issues, often going back to people's um, backgrounds or personal feelings, issues, really deep, intense information. Family education, it deals with their emotions and issues that they've had, but doesn't go quite as deep. Um, so family education, it's hard because it has to be a lot deeper than regular academics. Too much intensity risks hurting the participants or even scaring them away. Um, and it's hard because if you had something that was just regular, like academics, it would be very clear to know the line. But, as we know, family life education certainly is not just cut and dry. So then, like I just said, dealing with people, it's not so cut and dry dealing with people and their emotions and their inner workings of their lives. It certainly brings a lot more gray areas. Why does there need to be a distinction? Therapists must be highly trained, and they go through many hours of practice and training before they can help other people. And then someone who will be like me, a person who only has a marriage and family degree, they're not equipped to deal with intense personal issues and will feel just as out of place as a person they're trying to help if they go into the therapy realm of teaching. So then can maybe an educator can simply just avoid asking for personal stories or limit the comments to avoid falling into family therapy, but then you risk losing what is so important about education. Having participants share their personal stories and feelings can be an important part of the teaching. It can help further the educator's point, and it can help other participants see things in a potentially similar way to their own lives, because I might not share situations that the participants have had, so they might not be able to relate on the same way as maybe another participant there will allow them to. And it's important to know that therapy doesn't only deal with emotions, and the family life education does not only deal with the way that the people think. Those go hand in hand, and so sometimes that's how problems can arise. So an educator can't say that they will still steer clear of emotional issues. Doing so will deny people the education on potentially extremely important family issues. So it just kind of has to be accepted. Emotions and thinking have to go hand in hand. And so the National Council on Family Relations has created 10 content areas for family life education. They're families and individuals in societal context, internal dynamics of families, human growth and development across the lifespan, human sexuality, interpersonal relationships, parenting, education, and guidance, family resource management. Now, all of those deal with people, essentially, right? And so emotions are involved right off the bat. So, again, you can't get away from those. And then the rest of them are family law and public policy, which could be kind of cut and dry if you were to say, take out the emotions. As a family life educator, I don't want to steer anywhere near therapy, so I'll talk about family law and policy. But there could still be people who view it on an extremely emotional level, so then you run into that issue. And then professional ethics and practice, one wouldn't think that this would be an overly emotional thing, but we know ethics absolutely can be. And finally, the last one is family life education methodology. So there have been 4 levels that were set up, 5 levels that have been set up to help family life educators know kind of where they're at and if they're too involved and if they're not involved enough. So level 1 and level 5 are ones that a family life educator should never find themselves involved in. So level 1 is minimal emphasis on the family. So it may seem like a solution in avoiding crossing over into therapy, but it doesn't. But an educator doesn't work with their family. They aren't focusing on the family. They're being seen. This way is being seen as incredibly inadequate in dealing with family issues. And then level 5 is actual family therapy. This involves an extended series of sessions that are aimed at treating serious psychological and family issues. When a family sees a therapist, they are aware that they are dealing with mental health and not simply receiving education. Oh, my time's going so fast. So then level 2 deals with information and advice. The educator uses good skills in communicating clearly and asking questions, engaging the group. This is a good way for an educator to reach a large number of families with important information in a low-risk environment. Level 3 deals with feelings and support, and it adds on to level 2. The educator elicits feelings and experiences of participants and uses these disclosures as part of the educational experience. The educators are able to listen empathetically, probe for feelings, gently probe for feelings and personal stories, and make sure that that they've created an open and comfortable environment. And this deals with the normal stresses in everyday life, but does not focus on traumatic personal issues. And this is the best level that they found for most ongoing parent and family education activities and opportunities. So this is the level that most educators should stick to. And then level 4 is focused on intervention, and this combines level 2 and 3, and it includes an assessment and a planned effort to help the parent change this challenging problem that they have. But this is suited for work with families who are in high-risk situations, and it needs to be done by an educator that has a little bit more education, a little bit more training. So this is not for all educators, because they do, again, like I said, they do have to have additional schooling and training than is normally provided. So it's kind of the upper boundary of educators, and it's a small amount of them that would actually practice on this level. And so I think what is the most important is that understanding which level the educator is qualified for and comfortable with is an absolute first step in their effective teaching. And I just want to end with a quote from Maya Angelou. Prepare yourself so that you can be a rainbow in somebody else's cloud. And I think that's pretty perfect for us as educators and wanting to help people. So there you go. I hope you guys enjoyed it. Talk to you later.